Good evening, members of our Glenn County community. I'm Sheriff Richard Warren. I'm here with the Deputy Director of Emergency Services, Amy Travis. Um, we, like you, have just been notified of the emergency order issued by Governor Newsom tonight. And after meeting with staff, we wanted to go over what it really means and what some of those impacts may be. Again, this order isn't really anything new. It's just basically codifying what the recommendations have been going on. The impacts of this order will be the continued closure of public gatherings, the continued closure of bars, clubs, entertainment venues such as theaters, etc. Restaurants can remain open. We're asking that you still do takeout or delivery or drive-through options. We're asking you not to do any dine-in. And we're asking you to stay home when not doing essential functions. What are some of those essential functions? Going to and from work is definitely an essential function. Also, going to seek health care, any outdoor non-congregate activities, going to the grocery store, bank, gas station, or to pick up food, and the schools will continue to provide lunches. However, the schools will remain closed. This order does not restrict your movement or your travel. The order is intended to keep people from gathering and to make sure that we avoid as much social contact as possible. However, it is perfectly acceptable for your family to be together in your house, in your car, and to be less than 6 feet away from each other. No one expects you to distance yourself from your household members or your family. We, the Sheriff's Office, will not be coming to your businesses, your house, or pulling you over regarding this order. We are expecting you, the community, to use some common sense and good judgment and help us to mitigate any potential problems we have during this potential crisis for our community. Again, we have no confirmed cases of the COVID-19 virus in Glenn County. But with that, I would like to turn it over to Amy Travis, our Deputy Director of Emergency Services, to go over some of the health overview concerns.
Thank you, Sheriff. So COVID-19, also known as the coronavirus, is a serious respiratory illness. It has symptoms similar to flu, and those are fever, cough, and sometimes shortness of breath. Also, you may feel fatigue or malaise where your body aches. Those are typical symptoms very similar to the flu, and just like the flu, it's mild in most people. Only about 20% have severe illness, and that sometimes requires hospitalization and can lead to death in some people that are older than 65, especially, or those with chronic disease. That's why we're trying to prevent it from spreading from our community. So it is critically important that we all do our part to practice social distancing by staying at least 6 feet away from those when you're out in public, covering your coughs and sneezes, especially by your elbow, that's the best way, or a tissue. And throw that tissue away when you have used it. The other things that we can do is washing our hands at least 20 seconds with soap and water. Wash them frequently throughout the day, or use hand sanitizer when water isn't available. If you experience symptoms of the COVID-19 or flu, the fever or the cough, if they're mild and you are able to treat them at home, you should do so. If you become more ill and you need to seek healthcare, please call your primary provider and they will advise you on what you should do, whether you should come in, or if you have severe symptoms such as shortness of breath, you may need to go to the emergency room. Private providers are providing testing. You should call your private provider only if you have symptoms which require healthcare. With that, I'm going to turn it over to Sheriff.
Thank you. And again, we just want to reiterate, there are no confirmed cases in Glenn County. There's no reason to panic or to do anything different than we haven't started doing already. Use good judgment, common sense, and courtesy, and we will get through this together. Thank you very much.